So with chronic health issues, especially POTS, there are many things to do and many things to remember. And this is sort of a tip sheet on a video. There are many videos on this YouTube to go over, which maybe the first thing to go through is be patient with yourself. It may be good to watch the videos that are educational at times, and maybe even have a support person in your life to watch them with you once, twice, schedule time together in the week or in the month to say, let's watch them together and maybe watch them a few times. Often with a chronic health issue, there's information overload or too much information, and it can be just too much. So watch a video, take time, pause it, take notes, come back to it, schedule it, get yourself ready for information, because there is a reality of just too much information. Same as printed information. If your person's better on the computer, save it so you can read it again, share it with somebody. Or if you're more of a print person, print it, get a highlighter, take notes, circle it, share it with somebody, then discuss it, schedule a time to read it. We are in a time now of too much information, so it can be very challenging. So with chronic health issues, there are many of those aspects of just too much information coming through the internet, messaging, social media, and you really have to filter it. Many people with chronic health issues, by the time they come to diagnosis, have been either a catastrophic event has happened or delayed a diagnosis, which can lead to emotions of uncertainty, angst, worriment, bewilderment, overwhelmed, and leading to often diagnosis of health anxiety to PTSD or medical PTSD. So the too much information factor can be a triggering or activating symptom. So information education is important. So it's really important to be educated. So realizing that it can be a triggering, and it's important to maybe schedule time, saying this is my time to get ready for it, and prepare yourself with ever best relaxation mode, or working with somebody, your healthcare provider, a health counselor, a health psychologist, or a trusted person in your life to say, let's schedule time to do this together, or schedule time to say, this is the information I need, and come back to it over and over again. So with POTS, important concepts is hydration is important, which can be challenging because nausea and GI issues and feeding issues are important, relevant concepts. It has to be individualized to each person's needs. Just be mindful that electrolyte beverages can be also triggering with sugar, dyes, and chemicals, and people have economic challenges. So important to realize if you're consuming something, is it making your symptoms worse? Some people just do best with water, and being confident to start exploring, working with your provider or someone you know who also has diagnosis of what other supplements of hydration beverages that you can use. Some people just do well with water and adding a little Himalayan salt to their beverage, consuming through the day, generally 64 ounces, 84 ounces of hydration through the day. Often people wake up very nauseated during the day. So it's, and you want to maybe try to train in your gut to consume small amounts of water, hydration early in the day to get it retrained. It is hard and challenging, but maybe 4 ounces through the day, and slowly, slow and steady. Go low, start low is the mantra with hydration to get your body going. Maybe try to front load through the day so you're not peeing at nighttime. There's often adrenaline-induced urination urgency. It's like too much caffeine. It's like adrenaline, so it makes people want to pee and urinate often. So hydration is important because you got to fill up the blood vessels to do this, and the nausea induced by adrenaline will make people not want to hydrate, because the adrenaline will counteract the rest and digest of parasympathetic and cause a lot of the irritable bowel, bloating, constipation, diarrhea, and nausea. So you have to really slowly retrain, go low, start slow to get the body used to hydration best. And remember, is your hydration drink causing more issues for you in terms of aggravating GI symptoms, allergies, food intolerance, food inversions, and just economic challenges, because chronic health issues have economic impact. Same as salt. Salt is important because salt retains water. It creates intravascular volume expansion. Too much salt can actually bother the vestibular system in the inner ear and make things more challenging for people. So if you're increasing salt, getting more dizzy, feel more vertigo, back off the salt. Also, salt can raise blood pressure. POTS patients, due to the baroreceptor that helps keep your blood pressure from bottoming out. Most of you have moments of high blood pressure, so be mindful if you have tendencies for high blood pressure through your POTS, which is some of the confusion point for people to understand POTS, is that all of you are prone to hypertension. If you're prone to have blood pressure surges, back off the salt, just use it in your diet. Just use pure hydration and just use salt in your diet. Salt can also cause nausea and sometimes more GI issues of irritable bowel syndromes, of diarrhea, bloating, and sort of that laxative effect. One important thing also is compression stockings are not for everybody. They can be helpful. Compression as tolerated. Thigh high sleeves, arm sleeves, up to the thighs, stockings, pantyhose, binders, leggings for exercise. And some people just, you can look in the video, there's legs up the wall, yoga maneuver, or restorative bridge pose. It's in one of the videos. It can be painful, tolerance issues. Remember, the compression gear is trying to get the blood vertically up because all of your gravity challenge, getting the blood just drops and can't get it up. So compression stockings can be a hard issue due to pain, heat tolerance issues, and generally beneficial for the most of the people who have low blood pressure, dropping blood pressure. Those who have blue legs and low blood pressure are the most benefit. So it might not be as beneficial for the more hyperadrenergic, high blood pressure, racing heart rate POTS patients. Exercise is important. We're very sensitive. We listen to our patients about the exercise is important. And it's more about getting your body moving consistently. A patient self-advocate program we encourage for the first 1 year, where you have control and say to get the blood moving, muscles moving. You just use your body, finding something to do to help restore the muscles, blood flow to the muscles, to restore body motion, the joints moving, the joints getting blood flow to it, and really having say in it, as opposed to a plan that's maybe more dictated to you. We'll give you a template, but it's consistency over time. Even if it's 5 minutes a day, 10 minutes a day, we'll take people as simple as in their bed, lifting their legs, arm circles, or some people just climbing a flight of steps. But it's important, and we respect the fact that people are often told to exercise and left confused, bewildered, and dismissed, and that exercises often can be weaponized. And we want people to understand that it's important as part of a health tool, not just some wellness trend or a derogatory term, but it's important to help counterbalance the orthostatic pull. And it does help, knowing that most of our patients are very severely ill by the time they get to us. Adrenaline response, that is a survival tool, creates a very confusing messaging to the brain and the body and becomes sustained. And becomes an endless, confusing brain talk and body talk with the nervous system. And this is probably the most important tools, is this incessant, endless nervous system talk. And that even with medications that might control heart rate, the nervous system keeps talking, thinking your body is in danger, in survival mode. And work needs to be done to help control this. And so it can be as simple as good rest, wellness tools, hobbies, activities, spirituality, whatever keeps you in that place of wellness. You have to get that nervous system talk of survival down, regulated, turned off, that talk down. It can manifest as hypervigilance, because your body and brain thinks you're under attack. Pain becomes a nervous system response. Ongoing feeling your heart's racing, though your heart rate by vital check is fine. Dizziness, pain, tingling, burning, aches, spasms, muscle locking, all these response And it can be a lot of work from either medications, sleep hygiene work, mindfulness work, biofeedback, health psychology, hobbies, religion, spirituality, chair yoga, anything we can do, fishing, knitting, baking, all those things you can do that ever just shows your brain and body that it can be okay again. The nervous system needs to know they are not right when there's autonomic dysfunction, and it leads to endless, incessant talk from brain, body, nervous system, up, down, and down, up talk that something's wrong, and you have to show it that it's right. It could be 5 minutes, 10 minutes a day, and lots of work. This is part of the most important work to do because your nervous system thinks something's wrong, and you have to show it the right way. This is one of the most important things that you can do, and probably a missing step in a lot of autonomic POTS care, and that we recommend highly, often confused that people are, something's wrong with them psychiatrically, and that's a misstep that we really try to correct in our shared medical appointments and educate people about very importantly. Another important point is guiding appointments. There's so much going on. The autonomic system is pervasive ever in the body, being prepared for appointments. Think about the 1 or 2 issues you want to direct, write it down, send it in a mind chart message. Think about what do you want in that appointment with any of your providers. I work on my heart rate. I want to work on my nervous system going, feeling dizzy all the time. There's much to go. This is a chronic, ongoing issue. What do you want in that visit? Same as records. Many of you have many health records. Think about bring your most recent neurology note, your most recent cardiology note, your tilt table. Most of the records are in the system. It can be retrieved. Bring things with you that are most relevant. Use your visit for conversation. The most important thing is your most relevant conversation. And what do you want? Align your visit with your expectations. And that is such an important thing. What do you need and what you want? People want to know what you're thinking and get it very clear and respectfully across. The other aspect that's really important is social media in this era. It's everywhere and important and relevant, and we embrace it. But important is check your resources, know what it's about, respectful social media, and be also sensitive to the fact that many of you have been delayed to diagnosis, and it can be very triggering to social media, create more angst, worriment, and the content of social media. Is it one of affirmation and accolades guiding you to more education tools, or does it often create more of a negative space? Good social media often will be inclusive of medical providers and provide very good medical resources of documents and resource tools as experience, and it provides a space of, again, affirmations, respect, and tools, and less of a space of negative talk. And that's important because many of you have been delivered negative talk and need to be moved to a place of respect and acknowledgement. Often, most of you have been delayed diagnosis for months to years, and it's so important for all of you to have respect and to be moved to a place of acknowledgement. And that's such an important mission for all of us is acknowledgement and respect for all of you, knowing what you all have endured. That's an important aspect of social media. So in summary, one of the last things is the 10, 15 minutes a day of wellness, finding a space of where you can actually just bring your nervous system and body to a place of calmness and wellness to do this. And it can be challenging when your body is in overdrive and it seems very forced and artificial, but sometimes you got to force the hand and say, I'm going to do this for my brain and body, and learning how to handhold your brain and body. We go this a lot in our appointments and share medical appointments, but it is a start in the right direction. And it can be forced, but initially start sometimes it's laying there, playing music or an activity that you find. Many of the videos in our channel here helps, and a lot of our team members in our team will help you. But we know this is challenging, so be patient with yourself. This is a very hardwired biological response to keep your body functioning, survival physiology. And so the body wants to hold on to it, and it's going to take time. You need to be patient with your body and be patient with yourself, which is one of the most important concepts in closing up this video. We'll be patient with you. Be patient with your body and yourself. Bless all of you, and we believe in all of you and respect all of you. Take care. Thank you for being part of this.